The MAHOGANY study presentation is sort of a trials in progress presentation. That trial was based on a phase 2 study that was done in the second line setting that is going to be published in press this week in Lancet Oncology. And that study was for primarily second line patients after the initial dose escalation allowed for later line as well. And in that group of patients, the response rate in all comers was 18%. And when selecting for biomarkers like PD-L1 positivity and high HER2 expression, IHC3+, the response rates approach 50 and even 60%. Now, those were subgroup analyses, but they were pre-specified. So based on those analyses and results, and also due to the fact that, there is this concept of conversion of HER2 positivity from HER2 positive at the onset of newly diagnosed stage 4 disease with gastroesophageal cancer to HER2 negative after failure of first-line therapy. Therefore, that rate being about 50% of patients, the incidence of HER2 positivity goes down. And so the thought was, with those excellent response rates, very nice tolerability with chemo-free regimen, was whether or not this could be moved to the first line setting. And so the MAHOGANY study now is a 2 cohort study. The first cohort, cohort A, is a cohort that is a chemo-free first line regimen study for highly selected patients. Those patients have to be PD-L1 positive by a combined positivity score of greater than 1. And they also have to be IHC3+ for HER2. So that is a subgroup of HER2 positive disease. And that initial cohort is planned for 40 patients. And if some benchmark response rates and other outcomes are met, then that has room for expansion. There's a second cohort, cohort B, which is a more traditional randomized study of all HER2 positive patients. So those that are not only IHC3+, but also IHC2+, FISH positive, and any PD-L1 status. And so certain centers will be only cohort A or only cohort B. They can't be enrolling to both because cohort A would take those high levels away, and then all the others would go to cohort B at the same center. So you're either one or the other. And the cohort B study has a 4-arm phase 2 component, which is randomizing to standard of care chemotherapy plus trastuzumab versus standard of care chemotherapy, but then adding margetuximab, the anti-HER2 antibody, or a third arm of margetuximab plus MGA012, which is an anti-PD-1 inhibitor, and a fourth arm of margetuximab plus MGA013, which is a bivalent for both PD-1 and LAG-3. And so after the phase 2 is completed, a decision will be made as to which arm would be brought forward to phase 3 and compared to the standard chemotherapy plus trastuzumab arm. So that is the trials in progress poster, which has been presented before and also presented at ESMO GI this year.